Hi, I'm Michelle Ginsberg. I'm Director of Cardiothoracic Imaging and Vice Chair for Education at Memorial Sloan Kettering Cancer Center. And I'm also a Professor of Radiology at Weill Cornell Medical College. In patients with previously treated lung cancer, a new nodule may represent either recurrence of the primary tumor, whether that's a local recurrence or a metastatic lesion in that area, or a second primary lung cancer. This differentiation is challenging and really requires a multidisciplinary integration of available data, whether it's um, clinical, radiologic, pathologic, and molecular information. It's helpful to know the features of this nodule. For example, is it a solid nodule or is it a part solid nodule, meaning that it has both solid and sort of ground glass components to it? Is it spiculated, meaning that it's not smooth and or lobulated? Where is it located? All these things are helpful as far as characterization and also to guide decisions whether to biopsy and which approach to use to biopsy. Now, a PET-CT is very useful in such cases because if more distant disease is identified, it may upstage the patient. So a patient that has one of these new or really an enlarging nodule and has a history of lung cancer, we have a pretty high pretest probability that it's malignancy. If the nodule is 8 millimeters or greater, a PET-CT can be used because the threshold is acceptable to find a lesion. Or tissue sampling, because if it is avid on PET-CT, so it's a hot lesion, you may not know, is it still an inflammatory lesion or infectious lesion, or is it metastatic? So this is a discussion that should be done among the multidisciplinary group and maybe also involve the patient. Perhaps going straight to tissue sampling would give a more definitive diagnosis faster. Now, solid nodules, they're smaller than 8 millimeters, or these part solid nodules that have also a smaller solid component may require discontinued surveillance with CT scans and just observing whether there's a growth in the nodule. Now, patients have to understand that that they will be followed with screening with these CTs and may not have a definitive answer right away. We know that during the first 5 years after lung cancer diagnosis, the risk of recurrence from that tumor is higher. But after that period, having a second primary lung cancer is actually a higher risk in those that are cured from their initial lung cancer. So following these patients with CTs is critical.